It has been 3 weeks since officials in Cattaraugus County declared a state of emergency to combat the novel coronavirus outbreak there. Joining us live is Cattaraugus County's Health Director, Dr. Kevin Watkins, to talk more about how the virus is affecting his community. Dr. Watkins, thanks so much for being here today.
Thank you for having me, Justin.
First off, can you tell us about what the response has been like for your office?
Well, we had to fill a number of calls regarding questions on COVID-19, and we have been able to deal with those questions that we have. For the department itself, however, we have been in a mode of almost 24 hours of dealing with COVID-19, and thanks to our emergency operations center that opened up, it has taken some of the calls that we have dealt with from the public. But basically, the public wants to know what is it that the health department will do when a person has been identified with COVID-19. And what we normally will tell them is that we normally will quarantine an individual who is suspected of or who is positive for COVID-19. The health department will check on every individual in the county that has been identified as positive for COVID-19 or who's under investigation for COVID-19, and when we quarantine them, we check on them twice a day. We monitor their temperature and any other symptoms that relates to COVID-19. Those individuals have restrictions to travel within the county. And because they have these restrictions, the health department then go out and we will take care of any needs that they may have. For instance, any grocery needs or any medication needs that they will have. We also arrange for transportations for the individuals who may need to go to their medical providers or if they need to go to the emergency room secondary to becoming symptomatic for COVID-19. And finally, we assist quarantine residents with the appropriate documentation for paid sick leave benefits. Now, it's not just the health department that is working on COVID-19. As you may know, or as I alluded to earlier, we opened up our Emergency Operations Center. This Emergency Operations Center is staffed by all departments of Cattaraugus County. What the Emergency Operations Center does is it does the logistics for the county and for this COVID-19 initiative that we have undertaken. So providing PPE for all medical personnel within the county. They will supply testing sample kits for COVID-19 residents. They will assist for any local hospitals in finding more locations in order to increase their surge capacity. They do the planning for fatality for the county as well. They collect donations and for things like masks and gowns. They will provide us with the website for information on COVID-19 and other resources that are provided in from the community or needed by the community goes through our EOC. We have other departments that are involved in the EOC, like the Department of Aging. They will provide Meals on Wheels for those residents who are in need of some sort of meals during this quarantine period and or during this period in where we have asked our residents to shelter in place. We have the Health Department and Department of Social Services that will work on assisting residents who may need other supplemental income for food. For instance, WIC and SNAP. SNAP is Supplemental Nutrition Assistance Program. And of course, we have our mental health unit that is stand ready for anyone with mental health needs. Our mental health or community service department is there and ready for any type of crisis that might deal with those individuals who have mental health needs. And then finally, of course, we will provide shelter for the homeless. And of course, we will we will provide any other kind of assistance that residents may be in need of, as the county is still open and running fully staffed, but may not be fully staffed, but we are still able to provide the essential services that are needed for a county to run its operations.
And certainly the cooperation we've been hearing just like that from across much of communities here in Western New York. Now, as of last check, there are now 10 confirmed cases of COVID-19 there in Cattaraugus County, with 7 active cases and 3 people who have recovered. What can you tell us about the process of screening for COVID and what it's like when someone needs to go to the doctor to see if they do indeed have the virus?
Well, you are correct. We do have 10 residents who have confirmed positive findings for COVID-19. For a resident who wants a screening for COVID-19, they will have to have a script from their physician indicating that there is a need for COVID-19, as we are very depleted in the supplies that we have here to do that sampling. But with that being said, we have been able to at least deal with the number of requests that we have gotten from our medical providers' offices at this point. But we're down to almost less than 65 sample kits within the health department and less than 200 kits within our hospital. So those kits are getting far less than we are comfortable with at this particular time, and we're hoping that more samples will become available to us through the state and hopefully from the feds as well.
Do you have a timeline as to when those samples are expected to arrive? Because I know that a lot of counties across the nation are saying that they need more testing kits and they're just not available.
Well, and we're just like the rest of the counties and the rest of the state and the rest of the country who's looking for these sample kits that residents have been promised that they can have a sample or they can be tested for COVID-19 if they desire to have that. But that's just not true here in Cattaraugus County. We have no expected date of delivery for these sample kits, to answer your question, as those requests are oftentimes being placed off or put off for another or later date. And that's been most unfortunate for our residents of Cattaraugus County.
Now, according to a map, which is a great resource posted by your county on the county's website, kind of detailing where cases are and the number of people who are being affected by this, 63 are listed under a mandatory quarantine. You explained that process a little bit earlier here in the interview, but who specifically would that include? The people who are pending tests, their family? Who's under that mandatory quarantine?
Well, a person who has tested positive for COVID-19 would automatically go under mandatory quarantine. A person who has been in close contact with a known positive would be under mandatory quarantine as well.
Now, we've seen here in Jamestown that there's a bit of reluctancy out there for folks to be following these social distancing guidelines. Why is it so important for us to limit our contact during this pandemic?
Well, basically because we have no antiviral medication, we have no vaccine in order to treat COVID-19 at this time. So the only thing left in our arsenal as public health officials is to ask our residents to practice social distancing and to shelter in place at this particular time. Because if you are not amongst those who might be spreading the virus unknowingly, then you can prevent yourself and your family from actually getting infected by the virus.
Have people there been reluctant to follow these guidelines? What have you seen?
Well, we have seen that our residents, I would say the majority of our residents within Cattaraugus County, who's adhering to the request to shelter in place. But we do have a number of residents who tend to want to continue things as usual. because they feel maybe that they are impermeable to this virus, and or because of religion's feelings that they are not susceptible to this. For instance, we have an Amish community that tends to want to continue their daily practice of going to school, going to church, having weddings and things of that nature, and that has become problematic for Cattaraugus County and maybe other counties that may have an Amish community. So we are working with them, working with the bishops, and we've been informed that they've just increased the fine for those who continue to have mass gatherings or who will not practice the social distancing. And we're working with our sheriff department in order to to find those individuals who are reluctant to practice these social distancing and mass gatherings.
Is that what the enforcement would look like then? Is the sheriff's office, if they get a report of a mass gathering where folks there could receive the fine?
Well, the first thing the sheriff's department will do is look to break up those mass gatherings. But if by some chance that is repeated, I believe at that particular time, they will issue a citation. And the fine for the first offense can be anywhere from $1,000 and can go up even higher.
Now, finally here, we thank you so much for joining us on the broadcast today. Can you explain how the virus spreads? Because it seems like at first everyone was talking about washing our hands and that we wanted to try to protect surfaces, but now federally officials have suggested wearing face masks. Do we specifically know how COVID-19 goes from person to person?
Well, it is transmitted through respiratory droplets. So whether a person is talking to you, a person coughs on you, a person sneezes on you, you can contract the virus through respiratory droplets. So that's why it's recently recommended by CDC that residents of a community wear masks when they're out in the public. That tends to decrease the amount of droplets that can be expressed from a person when they're talking, coughing, or sneezing. And so that's why it's recently recommended to wear a mask. But of course, you don't want to forget that the virus particles can still stay on surfaces for up to 3 hours, and some say up to 3 days.
What do you recommend to folks who maybe want to have a mask, but they're in short supply because medical professionals are in need of those N95 and the surgical masks that we so commonly see now?
Well, a mask could be made from material that a person may have at home, a cloth mask. It could be made from an old t-shirt. It could be made from an old scarf. And you can use a rubber band in order to actually make the mask itself. It does not have to be one of the surgical masks that are used by medical personnel or N95 that is needed for medical personnel who care for a COVID-19 patient.
All right, Dr. Kevin Watkins, the Cattaraugus County Health Director, joining us today on the broadcast. Dr. Watkins, we thank you so much for your time and appreciate it.
Thank you very much as well.